Hello, lovely friend. I am Dr. Mary Barson.
And I'm Dr. Lucy Burns.
We are doctors
and weight management and metabolic health experts.
and this is the Real Health and Weight Loss Podcast. Hello, lovely listener. Dr. Mary here. And today I am very excited to be joined by the fabulous Dr. Karen Dwyer. So Karen is a kidney and transplant specialist. She's got over 20 years experience. She's trained at Melbourne University and at Harvard, and she is passionate about improving metabolic health in people with kidney disease and high blood pressure to help improve their health, but also to help prevent kidney disease in the first place. Karen uses lifestyle-focused approaches, including a higher protein, low carb nutrition to get to the root causes rather than just, merely managing symptoms. And she brings deep expertise and a fabulous fresh perspective. Thank you so much for being here. Karen, it's absolutely wonderful to have you with us. Could you please tell our lovely audience a bit about your journey and what has sort of drawn you to lifestyle medicine?
Absolutely, Mary, and thanks so much for asking me to be on the podcast. My journey, I am a kidney specialist and I've been practicing in kidney medicine for over 20 years now. And I think probably in the last 10 or so years, it became really clear to me that everything that I was doing was very reactive, and I was treating many people with the same condition, and it would work for a little while and then we'd go backwards. And it became very clear that our approach to medicine is very much a reactive, it's episodic, it's a Band-Aid approach. And it got me thinking about the root cause of disease, so moving further upstream. And then I think over the COVID years, I really did a deep dive into that and was listening to lots of podcasts and following different people online who were really challenging our current approaches, and I slowly started to pull in that, and now that becomes the bulk of my work. And it's very clear to me that many of the chronic diseases, whether it be kidney disease, high blood pressure, which I see a lot of, diabetes, heart disease, they're all metabolic diseases, and so they're all got that really common root cause. And I think my practice now is very much is metabolic, but is also as a kidney specialist. And I don't know if there's such a term as a metabolic nephrologist, but that's perhaps what I think I am.
I think there is now. I love it. Metabolic nephrologist. You should take it on. Could you tell our listeners more about that link between metabolic disease and metabolic health and kidney disease and the various ways in which that can take place?
Yeah, so absolutely. So kidney disease is a condition that is often silent. People often don't know that they have kidney disease, and we detect it when there's a reduction in the kidney function on blood tests, and potentially you're also leaking some protein from the kidney. And by the time that happens, kidney disease is established. So if you've got protein that's leaking into the urine, that suggests that you've got a scar. A bit like if you cut your hand and it heals, you get a scar. We can get these little scars in the kidney. So what we want to do is think about what's driving those scars. And if we think about what we're taught in medical school as the causes of kidney disease, it's things like high blood pressure and diabetes, and together they are the biggest cause of kidney disease, but also things like excess weight, particularly around the tummy, smoking and heart disease. And so when we sort of put that together, we need to kind of move even further upstream. So what's causing the diabetes and the high blood pressure, which is then causing the kidney disease? And that's when we realise that this is very much a metabolic condition. And the link between metabolic health and diabetes, I think a lot of people, particularly your audience, are very much aware of, but perhaps the link between metabolic disease and blood pressure they may not be so aware of. And in the last few years, my teaching has changed completely. At medical school, we're taught that 95% of high blood pressure is due to your genetics and the other 5% is a secondary cause. Whereas I've kind of flipped that paradigm now, and I say 95% of high blood pressure is driven by insulin resistance, which again, I know your audience is very familiar with. And if you look at the science behind it, when you've got insulin resistance, insulin acts directly on the kidneys and makes us retain salt and therefore retain water, and that will drive up our blood pressure. And it also has a direct effect on the blood vessels. So instead of blood vessels relaxing and allowing that blood to flow through, they become very tight and stiff, a bit like a lead pipe. And between the fluid being retained and these little lead pipes, it's pushing our blood pressure up. So, of course, when we start a blood pressure tablet, we get an initial response, but again, it stops working. So we need to move upstream, look at trying to improve our metabolism. And then, of course, there is a role that we may need some medicines to completely support somebody's health, but it allows us to use the lowest dose possible, and that minimises side effects. And so there's a lot that is beneficial if we improve that metabolic health to start with.
Yes, it improves multiple aspects of our health and our life. And I love what you said about medication. Medication is useful and powerful, and we don't want to dismiss it, but we always want to be able to use the lowest effective dose where possible. And it's not like medication or lifestyle. It's very much both, and that they complement each other. And sometimes you don't need the medication and sometimes you really do. And both are okay.
Absolutely, yeah.
How do you then, you see as a kidney specialist, our kidneys are incredibly important. Tell us the ways in which you help your patients improve their metabolic health. What's the journey that they would go through?
Yeah. So I think probably one of the things to start with is people don't expect me to be talking about that when they come to see me, because they've come to see me about my kidneys. And kidneys often don't have many symptoms associated with them. So chronic kidney disease is a very silent disease. You can lose up to 90% of your kidney function before you may develop symptoms. So it's one of these things that is just bubbling along in the background. And so I see my role is to support people to live their best life. They want to feel well. So, I start just about every consultation is, how can I help? What are your concerns? And how can I support and help you with those concerns? Because inevitably they'll be linked with metabolic health, with the kidneys, high blood pressure. And so it's really addressing symptoms, and from symptoms we can then integrate those lifestyle pillars to improve health and well-being.
And what are those lifestyle pillars?
So the big one for me is certainly nutrition. I think that's certainly the most pervasive. So I talk a lot about nutrition, physical activity, sleep, and stress. And if the conversation is not sort of progressing, I often look towards sleep, because everybody wants a good night's sleep. And so often that's something that people can see some opportunities for change and see some immediate outcomes, whereas perhaps sometimes changing other aspects of lifestyle can be somewhat challenging. But they're the four main pillars. And I also like to talk about circadian rhythm and getting some early morning sun. But yeah, probably the big four are the sleep, activity, nutrition, and stress.
Yes. And I bet some people would be surprised having this conversation with their kidney specialist when they've been sent to see you because a problem has been detected in their kidneys. But it's absolutely fantastic, because this is what is truly going to have, we call the pleiotropic effects. It's going to affect not just one aspect of your health, but many, many aspects of your health. And sleep is good. If you have a good night's sleep, it becomes much easier to create room in your brain to make other changes.
Yeah, absolutely. And I think the education component is really important, and linking these things together. And I do hope that that's quite empowering for people to have the understanding that the heart disease that they may have, and the diabetes and the kidney disease, sort of having all those conditions, I think can be very overwhelming. I have this, I have this, I have this, I have this. But in actual fact, we have one issue that if we can bring those all back to that root cause, perhaps that's a little bit more manageable for somebody to come to terms with, and also to make the change, because you do see one change could have these pleiotropic effects. So I could be improving my blood pressure, I could be improving my diabetes, I could be improving my kidney function. Wow, that's a good return on investment. So it's not sort of going, well, today I'm only talking about your kidneys, because kidneys don't walk into my room, a person walks into my room. So it's trying to address it more in a holistic wraparound approach.
Yes, I love that wraparound care. And as a general practitioner, I just love to hear you say that. And I know that this is how most doctors think, that we are whole people. We're not just little single organs on a stick, brain on a stick, or kidneys on a stick. We are whole people, and we're whole people living our lives. And like, disease is like that interface where suffering kind of filters through and interacts with our real lives. And that's where we need to help people, is we need to help people with how they're living, and then the choices they're making, and then they are able to nurture their whole bodies back into health. I would love to hear, if you could, don't have to share specific stories, but you could even talk more generally, or if you do have specific stories, you could share about how people are able to improve their health, sort of working on these pillars of health that you describe.
I think a lot of people don't realise they've got the power to change. And perhaps it's the language that we use. We talk about chronic disease, and chronic disease sounds very permanent and progressive, and it's chronic. So it's there for a long time, and perhaps it's there all the time. And I think we do need to change that narrative in medicine, sometimes our language is awful, like, chronic kidney disease. We talk about stages, stage 1 through to 5. And I once had somebody come and they were so worried because they said, well, I've been told I have chronic kidney disease stage 3 and there are only 5 stages. It's like, oh my goodness, what a great learning for me, because you're a long way from trouble, but it doesn't sound like it.
No, it sounds terrible.
Yeah, so language really matters. And so I think the first thing is that a lot of people would love the opportunity to take charge of their health, and they don't know what they can do. And so when you provide the information that by making some changes in this domain, or this domain, these are some of the potential effects, most people that I find really, really enjoy that and really take it on. Not to say that it's simple or it's easy, but, if you're there to support along the way, then it's possible, and there is hope. I did have a case just recently, and in fact, I saw this person only last week, and he's blown me away. And I did say to him, if it was okay, I would love to share his journey in all these different forums. And so I do have consent. Of course, I will keep it anonymous, but it was just such a striking example to me of what is possible. And so this man I saw at the start of May, and he was really unwell, so unwell that I admitted him straight to hospital from outpatients due to his really high blood pressure. He was very wobbly on his feet. He was carrying lots of fluid and just in a really, really bad way. And for the first 5 months of this year, he'd been into hospital, I think, 3 times. So this was the 4th admission in 5 months. And in a few days in hospital, of course, I did multiple changes to medications, but one of our big things to focus on was nutrition, because the diabetes was not that well controlled and he just was, running on empty. I often use the analogy that we are a car and we need a full tank of petrol, but it needs to be the right petrol. Don't fill me up with diesel if I'm a petrol car, because that's just not going to work. So his kidney function was quite poor at the time. It was sitting at around 20%, and it had been even a little bit lower. But he couldn't work on the farm. He just retired, and he was, in a really bad spot. And I think he thought that perhaps this was the start of a really serious decline. So he went home and we touching base, and I saw him last week. So it's just a little bit over a month since, maybe 6 weeks since I had seen him, and he is incredible. So he is energetic. He's back out on the farm. He isn't carrying any fluid. His blood pressure is much better. His kidney function's now sitting at over 40%, and his diabetes is down under 5%. or under 6%, so it's 5.5%. And he said to me he knows it's the fuel that he was putting into his body wasn't right. He needs protein to be able to be out on the farm, and he's got that realization now. And it's really easy now for me just to do little tweaks along the way, because he's taking charge of his health and well-being. And it was just so dramatic to happen so quickly from someone that I wasn't quite sure if he was going to get, any recovery of kidney function, and, is it the start of, do we need to talk about dialysis and, what's going on next? And he's a different person. And it happened so quickly that it's blown even my mind how quickly he's taken charge. And kudos to him, because it was just, a few bits along the way. But, I guess when you look at your life and you can't do the things that you want to do, it's a big decision point, isn't it? And he made the decision and he needed the support, and off we go. So that was really wonderful. And I've got a few people recently that have just, they make you really happy. And one person that, and I don't get to discharge people from my clinic very often, but I recently was able to discharge someone, and I go, that's amazing. You've fixed everything. I'm here if you need, but I don't think you need me. So it's wonderful.
Oh, I do love that. It is such an inspiring story. He turned his health around by being motivated, by having the right information, the right support, and being able to do it. You mentioned nutrition is one of the main pillars. It certainly is one of our main pillars. I mean, we align almost completely. I think we probably actually do align completely in in how we feel about the pillars of lifestyle medicine. Protein. I would love to ask you, as you are, a nephrologist, a kidney specialist, about protein, because this is a question we get a lot, that we encourage people to prioritize their protein, and we go for about that 1 gram of protein per kilogram of body weight per day. But people can be afraid of that, particularly if they've been told they've got some kidney impairment, because there is this sort of still this lingering idea that you must limit protein if you've got kidney impairment. Could you tell us more about this?
Yeah, and I think that lingering idea is a really nice way to frame it. And look, it wasn't that long ago where the mantra was, if you had kidney disease, we needed to restrict protein because the protein was putting, too much pressure on the kidneys and causing a decline in kidney function. And that narrative arose from studies many, many years ago that perhaps weren't as well conducted as you might like, and also at a time where we didn't have other approaches that do support kidney health. And so it's interesting, things are changing, and even our overarching guidelines have now changed to increase that protein requirement during the day to, I think they say 0.8 per gram per day. I use 1 because the maths is so much easier. But I also think we need to remember that that's a minimum. So 0.8 that we have in our guidelines is a minimum. And, of course, we need to adjust that to what else is going on for that individual in terms of age and activity and, other parameters. So I think 1 is a nice starting point. There has been a lot of recent publications looking at protein in kidney disease, and it's really great to see that everything is supporting a higher protein intake. And just a couple that come to mind was quite a large epidemiological study looking at frailty and kidney disease, and below 0.8 grams per kilogram per day, there was greater frailty, and so higher protein, less frail, and lower mortality, which was another big study. So I think we're getting a lot of supporting literature and evidence to show that we need protein, because if we don't have protein, we lose our muscle mass, and therefore our kidney function looks a little bit better. So in some ways, it's a little bit of a numbers game with kidney disease, and protein certainly doesn't cause kidney damage. And what we now see is that it really does support kidney health.
Yes. It's a fair bit, isn't it? Like if we're going to say what we're just, because maths, I just make maths easier, 1 gram of protein per kilogram of body weight a day. So if you weigh 90 kilos, 90 grams. If you weigh 100 kilos, 100 grams. 70 kilos, 70 grams. That's the minimum. We want to be having more. How do you help people make that change? Because for a lot of people, that actually can be a fairly dramatic increase in protein.
Yeah, absolutely. And I think that's the key. If you tried to go from a sort of a low protein up to your, 80 or 90 grams per day in one hit, you won't get there. So I like to just at least highlight the importance of protein, and I'm looking for ways for incremental increases. For example, I have a couple of sayings so that, whenever you eat, just to look where your protein is, can you identify it? And that might be, whether it's Greek yogurt or a bit of cheese or whatever, but we're always looking for some protein. And then I put a lot of emphasis on that first meal of the day. So when you break your fast, whether that be at 7 a.m. or midday, whatever works for you, we want to make that a protein-rich meal and try to get at least sort of somewhere between the 20 to 40 grams of protein, depending on your size, with that first meal. And I think that's really important for many reasons. It fills up the tank so that you do have a full tank for the day. So it's great from an energy perspective. We're not going to get that big burst of insulin that you might get with a high carbohydrate meal. So it's less inflammatory. And so I think that's really important. But our body works on cells and enzymes, and it needs the right fuel to work for the day. And all our enzymes are made up of protein. So if we're not providing protein, it's really hard for our body to actually work properly. So I really aim to work on that first meal of the day. Let's try and get a protein-rich meal, and then we work on the subsequent meals across the day if that's needed. Sometimes it's just we just need that first meal, and things are trucking along really well and people feel well, and then that's great. But those sort of incremental changes and really emphasizing that first meal.
I love that. That's doable and actionable advice. Yes. I would love to ask you also about salt, because this is another question we get asked a lot. And how do you guide people who are on a higher protein, lower sugar, lower processed food diet? That's what you encourage them to eat. How do you guide them with salt intake, especially in the context of kidney disease?
Yeah, so again, this is another thing that has been really drummed into us for many, many years, that we need to avoid salt because it causes high blood pressure, and we need to avoid salt from a kidney perspective. But again, we need to think about this in context. So if we have high insulin levels, then absolutely we need to think about not taking excess salt, because the insulin's really doing a lot of that anyway. So I mentioned before that insulin works on the kidney and it makes us retain salt. And when you retain salt, you therefore retain fluid. So if you're reducing your insulin level, then all of a sudden your kidney just wheezes out a lot of salt and therefore a lot of water. And that's why when you first start eating with less carbohydrates, the initial weight loss can be quite significant, and that's mostly water. So we're just getting rid of all that fluid. And in that situation, then you do need to have a little bit of salt. So I think, we need to think about which crystal are we talking about. We've got salt and we've got sugar. And if you're eating sugar, you need to be very careful of salt. But if you're not eating sugar, whether that be refined or through carbohydrate or whatnot, then you may well need some salt. And, I'm always very conscious that as people change their diet, we need to watch out for feeling lightheaded or dizzy or cramping. And these are signs that perhaps we either need to cut back on some other medications, in the case of dizziness and high blood pressure tablets, for example, or perhaps there's the need to add a little bit of salt, because we also know that the majority of our salt in our diet comes from ultra-processed foods. And if you're not eating those, you're not getting that excess amount. So it's not as easy as what we make it out, is it? Just don't have salt. There's a lot of nuance to it. And if you're eating real whole food, a little bit of salt is probably okay, but of course it does need to be considered in the context of your health conditions and your medications. But it's something worth discussing with your clinicians or your tribe as to what is going to work for you.
Yes, thank you. That is good, sage and sensible advice. You mentioned right at the start that kidney disease is a silent disease. Like, people can lose up to 90% of their kidney function before they start to show symptoms. So for our beautiful listeners out there who are perhaps concerned about their kidneys, or they just want to check in on their kidneys, what could they do?
Yeah, absolutely. So I love this question because we want to be proactive, don't we? So there's a really simple test to do called a kidney health check. And this is where from your doctor, you ask for a kidney health check, and it involves a blood test to look at your kidney function by a number, and a urine test to see if you're leaking any protein, and a blood pressure. And those three parameters are what we utilise to determine if there's any evidence of kidney disease. We recommend a kidney health check for anybody that has pre-existing diabetes or high blood pressure or heart disease or that excess weight around the middle. Absolutely, I would encourage you to have a kidney health check. But it's also important to have a kidney health check if you've got a family history of someone with kidney disease. So you may have a parent or a grandparent or somebody that's been on dialysis or had a transplant or had kidney issues. If you've ever had an episode, and often this is when you've been admitted to hospital for something else, and that you may have had what we call an acute kidney injury, and that's where the kidney function might deteriorate a little bit, but the kidneys are quite resilient and they do recover function. But just like when you cut your hand, it heals with a scar, we can get that same sort of process happening in the kidney. So we recommend to have your kidneys checked if you've had an acute kidney injury at any time. And if you don't have any of those factors, then we would just suggest having a kidney health check at age 60 if you're non-Indigenous, or if you're an Indigenous person to have a kidney health check at age 18. And the reason for that, there's quite a discrepancy there, is that we know amongst First Nations Australians that there's an excess burden of kidney disease. It tends to present quite early and can progress quite rapidly. So again, we want to be very proactive and identify if there's any issues as early as possible. But if you're being proactive, then that allows us to really engage in that prevention space as well and try and support so that you don't develop any kidney problems.
Yes, that is fantastic, because our kidneys are extremely important. So it's pretty easy, isn't it? It's a pretty quick and relatively painless test that you could get with your GP or your health team.
Absolutely, yeah.
I love it. So what do you think is sort of the future or your future hopes of where do you think that we are heading with managing chronic kidney disease?
What we know is that our current health system is in crisis, really. General practice is underfunded and there's not enough general practitioners to see everybody in the community. And as I said, the funding model's perhaps not ideal. Public hospitals are overstretched and probably, again, underfunded. And so we've got this chronic disease that's continues to rise, but our ability to support people is more constrained. And that really does then lead to reactive episodic care, and it leads to burnout. So we have people actually leaving the profession. So what I would really love is for us to sort of really look at the health system, and prevention is so much better than cure. So if we've got the resources in place and the education and the time, that we can really move very much upstream and walk with people along this journey rather than having these touch points every now and then, which is adding another Band-Aid to, a long list of Band-Aids. So I think our health system does need reform in how we are able to serve the community. And I also think we need to look at, there's a concept called values-based healthcare, and there's multiple aspects to that. There's, person-centered values-based healthcare. What's important to that individual and how do we support that person meeting their goals? Then we've got to think about values-based in terms of the investigations that we do and the care that we provide and where we provide that care and who provides that care. So, there are certain things that probably I shouldn't be doing, but perhaps, if I had a health coach, they could be providing those multiple touch points and I'm doing very infrequently. So I think we need to rethink chronic disease and move very much upstream into the prevention space.
Oh, thank you so much, Dr. Karen Dwyer, for giving us your time today. It has been a wonderful and eye-opening conversation, and you have shared some extremely valuable insights. So thank you very, very much.
It's my absolute pleasure, Dr. Mary, and I look forward to working with you further in other projects. Thanks.
Yes, very exciting. Bye now.
The information shared on the Real Health and Weight Loss podcast, including show notes and links, provides general information only. It is not a substitute, nor is it intended to provide individualised medical advice, diagnosis, or treatment, nor can it be construed as such. Please consult your doctor for any medical concerns.